There's no such thing as a good or a bad intervention. It's all about a risk-benefit analysis to see what medical choice is right for you at the time. So for many women, taking an oral contraceptive pill is an amazing solution. If your goal is to prevent pregnancy, it's an awesome option, especially if you're somebody that doesn't have any side effects from taking it. There are also other alternatives, and you don't have to rely on the oral contraceptive like a hormonal IUD, a copper IUD, or the rhythm method, but for a lot of women, maybe those aren't available for whatever reasons, and the oral contraceptive works fine for them. Sometimes it's important to support that women with different nutrients like vitamin B6 to make sure that they're able to process those extra hormones a little bit better. But really, it's as a rule, the birth control pill is not good nor bad. However, we are giving it to a lot of women not for pregnancy prevention purposes, but instead as a means of managing hormonal symptoms. And in that way, I think it's not a great tool because there are a lot of other things that we can do instead that don't come with the same side effect or risk profile associated. The most common side effect for the oral contraceptive, the birth control pill, is usually weight gain and mood. There are other side effects, but we don't see those in our practice as much. It's usually the women are coming in because they want to stay on the birth control for their personal reasons, but they're not handling it very well. So we have to support their system in their ability to manage that external hormonal input. There are also, however, long-term risks of taking hormones of any kind, whether that's oral contraceptives or hormone replacement therapy for perimenopause and menopause. So in order to make the right medical decision for you, you really need to know all of the data. You need to know how your personal risk factors calculate in, and so that you can figure out, is this the right choice for me or not? And how long is it a good choice for me? Is it up to 5 years I can handle this extra hormonal load, but after that it may increase my risk of breast cancer, so I have to reassess. So really just making sure that you have an informed conversation so that you can make an informed decision when you're discussing this with your healthcare provider. And we find as naturopaths, the family doctors don't really have a lot of time to do that. So our patients will then book with us, and then we give them the research, the literature, and then with our support, they're able to make the informed decision that they need to make.